So an awful lot to get through. It's been almost 6 months since Covid-19 was declared a public health emergency, and this is what's happening.
The pandemic continues to accelerate. In the past 6 weeks, the total number of cases has roughly doubled.
So let's take a detailed look at the pandemic, how it's escalating and also how it's being tackled. And we should start with some headline statistics. I'm afraid they're stark. There are over 640,000 confirmed fatalities and more than 16 million confirmed cases worldwide. And look at the infection rate the WHO was talking about. It took 38 days to go from 5 to 10 million confirmed cases. To go from 10 to 15 million, that took only 24 days. And the last million confirmed cases took 4 days. So the infection rate is increasing. And you can see the global story of the pandemic in these graphs. The virus was first identified in China. There were then major outbreaks in Europe and North America in April. As they began to ease in May, Latin America and Asia saw significant outbreaks of their own. And while Europe's case numbers have largely continued to fall, North America has seen a resurgence of infections, mostly in the US, and Latin America is now the epicenter of the pandemic, with Brazil by far the worst affected country there. And despite the complexity of this pandemic, the WHO says in some ways this is a simple challenge.
Find, isolate, test and care for cases and trace and quarantine their contacts. Keep your distance from others. Clean your hands, avoid crowded and enclosed areas, and wear a mask where recommended. Where these measures are followed, cases go down. Where they are not, cases go up.
Now, we've often featured analysis on Outside Source that says the only real end to all of this will come when there's a vaccine. But now we have a caveat against that too. The virologist Klaus Stohr played a key role for the WHO during the SARS pandemic in the 2000s. He said the majority of the world population will not receive a vaccine. The virus will continue to spread. It could take 2 to 3 years before the virus has affected a large majority of the population. He goes on, it's not the vaccine that's going to end the pandemic. The virus will end this pandemic by burning every piece of dry wood it will find. The fire will not go out before the last susceptible person has been affected. And he's spoken to the BBC today.
80% of the global vaccine production is located in European countries. There's also, of course, in the US. India has a significant vaccine production, but it will not suffice to immunize that many people, to produce a vaccine first and later on immunize that many people before the virus will have spread globally to almost every person by most likely end of next year or in 2 years' time.
Now, around a quarter of all confirmed cases of Covid-19 are in the US. Close to 150,000 people have died there because of it. And the numbers continue to worsen, both in terms of reported cases and deaths. Florida, Louisiana and Mississippi are a particular focus. Between 400 and 500 people per million are confirmed to have the virus every day in those states. And for context, most states in the US are below 200 for the equivalent statistic. And this graph from the LA Times shows that infection rates in California are also heading in the wrong direction. Well, judging the impact on the US economy to some degree depends on where you look. Much has been made of the gap between Wall Street and Main Street, and this is why. When the scale of the virus became clear, markets tumbled in March. But since then, major US companies, like those listed on the SP 500, have seen their share value recover in quite some fashion. That may be connected to the over $2 trillion of emergency spending that Congress approved. For whatever reasons, Wall Street has had a good few months. This, though, is what's happened to US unemployment. This graph's from June. We know there are around 30 million people claiming unemployment benefit of $750 a week. But unless there's a new deal by the end of this week, that will drop to $150 a week. And of course, that will impact directly on people's lives in many ways. It will also significantly reduce the money they're able to spend in the US economy. And here's a report from Michelle Fleury looking at just that issue.
More than 30 million unemployed Americans are getting an extra $600 a week in benefits. That's 1 in 5 US workers. Lou Benavides, a music merchandising tour manager, is one of them.
My income has been zero. Like from the second that the pandemic started and the music industry shut down.
What's been keeping him afloat is this payment from the government.
I can't even explain how much of an impact it had on me, because it's something I needed to do anything, you know, for groceries, rent, like car payments, cell phone payments, like everything.
But a fight in Washington could change that. The extra money is about to disappear at the end of the month unless Congress renews it. For those who depend on these checks, it's frustrating. How will you cope?
Like, that's something that I've been thinking about for the last month. And their inability to act efficiently is very telling of like how they feel about people that need this money.
The additional money is not just helping Lou, it's helping the economy at large, allowing unemployed workers to keep spending. 2/3 of all economic activity comes from consumer spending. If the payment were to disappear entirely, it could lead to a 2% reduction in GDP. But Republicans are unlikely to extend it at its current level. They want to write smaller checks, arguing the extra cash discourages Americans from finding new work. Brandon Humberston, who makes more on unemployment than he did as a cook, says those fears don't reflect the reality on the ground.
You can't get a normal job now. It's kind of dire and depressing, but it's true. Like, I know a lot of people are resorting to drug use. Everyone's depressed, everyone's anxious, there's no hope for the future. You know, you're just sitting inside your house all day waiting for something to change. And it's a very powerless feeling.
With the virus resurgent and reopenings on pause, economic conditions are deteriorating. And with millions of Americans out of work and many more in danger of losing their jobs, lines at food pantries like this one in Brooklyn are getting longer. Congress looks unlikely to act in time. The extra unemployment benefits, a lifeline for many Americans, will end at least temporarily. And more American workers will struggle to feed their families.
Now here's some better news on COVID in the US. The biotech company Moderna has begun phase 3 trials of a vaccine for the virus. The ambition is to have it fully developed by next year. A few minutes ago, President Trump welcomed the announcement, saying it was made possible by a federal program to help companies develop a vaccine dubbed Operation Warp Speed.
There's never been anything like this in terms of speed, nothing even close. A second vaccine is likely to enter phase 3 in a matter of days. Under Operation Warp Speed, we've shaved years off of the time that it takes to develop a vaccine, in some cases many years, and we've done it while maintaining the FDA gold standard for safety.
Now, Moderna's vaccine will now be tested on 30,000 people. The hope is it can then be submitted for regulatory approval. Well, let's speak to Ian Hayden, one of 45 people who volunteered to be injected with this potential vaccine in Moderna's stage 1 trial back in March. He joins us live from the US. Ian, thanks for your time. Tell me about the calculations you made when you decided to say yes to taking part.
It was pretty simple for me. You know, I'm fortunate enough to be in good health, and I happen to live in a city where an early coronavirus vaccine trial was taking place. So it seemed like a responsible way that I could help out in this trying time.
So you decided to say yes. What happened once you'd done that?
Yeah, so initially I went in for a physical, a screening visit, which included some blood work. Once that looked good, I came in for the first injection, which was pretty uneventful. I'd been monitored by the clinic ever since then. After a month, I got my second dose. And that was back in April. And since then, I've been just doing blood work and being monitored by the clinicians running the trial.
And help me understand the different experiences of you and the others in this small group who are taking part in the trial, because you weren't all given the same treatment, is that right?
That's right, yeah. So part of this phase 1 study, this earliest test, is to figure out what the right dose of this vaccine is. We don't know if it's going to work, and we don't know what the proper dose is. So a low, medium, and high dose of the vaccine was tested in phase 1. I was one of the first participants who got the highest dose, and it seems that was a bit too high. I ended up for about 24 hours with a high fever and nausea and some other symptoms. So based on that experience and the experience of about 2 other participants who also got the high dose, the Moderna, the company behind this vaccine, is moving forward with the medium dose for phase 2 and 3 testing.
You state that you didn't feel well in a reasonably matter-of-fact way, Ian, but having read a couple of other accounts of what you went through, it sounds like, at moments at least, it was a reasonably uncomfortable experience.
Yeah, for about 24 hours, it was pretty rough. I woke up with a high fever and nausea. I ended up going to urgent care 5 in the morning, and I was met there by the lead researcher on the phase 1 study. They wanted to run some tests on me, make sure that I was doing well. Luckily, those symptoms passed in about a day with just some IV fluid and Tylenol. I spent most of that time at home. And aside from that one brief episode, a day of feeling unwell, I really had no other symptoms to report from the entire trial.
And is your involvement in the trial now done as it proceeds to the next stage?
So these trials are happening in a staggered fashion. So phase 1 will continue to happen, even though 2 and 3 have now begun. So I'll be monitored for a full year after having gotten the second dose. So I'm going to keep going back to the clinic for blood work into next spring.